Birth control should be sold over the counter without a prescription for those 18 years of age and older. The availability of oral contraceptives to women without a prescription is far lower than those with a prescription in the United States. With access to these contraceptives, unplanned pregnancy, negative health effects, and abortions could be reduced. There are two American ethics that go hand in hand with this idea. The first being personal autonomy, which allows patients to make decisions for their own health that align with their values. This allows patients to be in control of their own bodies and their decisions, and part of that is choosing which method of contraceptive you would like to use. The other being beneficence, which promotes well-being and the prevention of harm to patients. By allowing access for people who are 18 years of age and older, you are allowing well-being to be better because they will be able to prevent pregnancy rather than having to go through the dangers of having an abortion, because there are many complications that can come with that. There are also many different principles such as legal, ethical, and economical that come into play. The pro for this in terms of legality is that women will have more access to oral contraceptives, and there will be less lawsuits for pharmaceutical companies because they will be having their own personal choice in which contraceptive that they choose to use. And from an economic standpoint, this is a good thing because people will be able to get a prescription and pay for it rather than having their insurance cover it. So this will be good for insurance companies, and this will also be good for patients because they will be able to have access to the contraceptives. Scientifically, this is better because then they can be in control over which form of contraceptive they choose to use, and they will have to be warned of those risks. And as a pharmacist, whenever you're getting a new medication, they'll warn you about it anyways, because that was a large possibility for lawsuits, was that pharmaceutical companies were hesitant to allow over-the-counter birth control to become legalized because they felt that it was dangerous. But when you get a prescription, the pharmacist is legally supposed to ask you about whether or not you have taken the prescription before and advise you how to take it properly to reduce the possible side effects and harmful effects. On the other hand, some people believe that by legalizing over-the-counter birth control, they are trying to encourage people to have underage sex and people to have premarital sex. This is a big opposition in the religious community because they feel that this is encouraging poor behavior. Economically, legally, and ethically, it's just better that people have the opportunity to choose which form of birth control they want to use, and if they are 18 years of age and older, they are able to make that decision for themselves without a prescription.